Norellis sponsored brother and sister Labrador Retriever puppies from Little Angels Service Dogs. This special program was designed to help them become seizure alert dogs for 2 people living with epilepsy. Norellis named the pups Val and Toco after their immediate use seizure medication, Val Toco, diazepam nasal spray, for episodes of frequent seizures.
Our mission at Little Angels is to place specially trained dogs with individuals with disabilities, both children, adults, and to help them live a more independent life.
Little Angels seizure alert dogs are trained to detect oncoming seizures, retrieve important items that may include an immediate use seizure medication like Val Toco, call for assistance, and support the person until help arrives.
Once a dog has been matched with a recipient that has seizures, we ask the family members or loved ones of that recipient to collect scent samples. This is done during or immediately after a seizure.
Once dogs have learned to recognize their person's seizure scent, they are trained to alert the person or their care partner by pawing at their leg.
The dogs are trained to do many things after a seizure. Typically, the dog will alert and dial a phone, ring a bell, whatever they're trained to do. Each dog is trained differently. And once that is complete, they will run and get their vest and retrieve the vest, which has the immediate use medication in it, and bring it to either the recipient or their caregiver.
Val and Toco have grown so much in the program. Although they love to play, they also take their work very seriously because they know they each have an important job. After celebrating their first birthday together, Val and Toco began preparing to go on separate journeys. Destiny led Toco to his forever family in Hawaii. Val found hers in Texas.
When a dog is placed with a recipient, especially the first day when they meet, it's very emotional. A lot has gone into the training for this dog, and to see it pan out and to see someone benefit from that is amazing, but very emotional at the same time.
What is Val Toco? Diazepam nasal spray. Val Toco is a prescription medicine used for short-term treatment of seizure clusters, also known as episodes of frequent seizure activity or acute repetitive seizures, that are different from a person's normal seizure pattern in people 2 years of age and older. Val Toco is a federally controlled substance, C4, because it can be abused or lead to dependence. Keep Val Toco in a safe place to prevent misuse and abuse. Selling or giving away Val Toco may harm others and is against the law. Tell your healthcare provider if you have abused or been dependent on alcohol, prescription drugs, or street drugs. It is not known if Val Toco is safe and effective in children under 2 years of age. Important safety information. What is the most important information I should know about Val Toco? Val Toco is a benzodiazepine medicine. Taking benzodiazepines with opioid medicines, alcohol, or other central nervous system (CNS) depressants, including street drugs, can cause severe drowsiness, breathing problems, respiratory depression, coma, and death. Get emergency help right away if any of the following happens: shallow or slowed breathing, breathing stops, which may lead to the heart stopping, excessive sleepiness, sedation. Risk of abuse, misuse, and addiction. There is a risk for abuse, misuse, and addiction with benzodiazepines, including Val Toco, which can lead to overdose and serious side effects, including coma and death. Serious side effects have happened in people who have abused or misused benzodiazepines, including diazepam, the active ingredient in Val Toco. These serious side effects may also include delirium, paranoia, suicidal thoughts or actions, seizures, and difficulty breathing. Call your healthcare provider or go to the nearest hospital emergency room right away if you get any of these serious side effects. Use Val Toco exactly as your healthcare provider prescribed. Physical dependence and withdrawal reactions. Benzodiazepines, including Val Toco, can cause physical dependence and withdrawal reactions, especially if you use Val Toco daily. Val Toco is not intended for daily use. Val Toco can make you sleepy or dizzy and can slow your thinking and motor skills. Do not drive, operate heavy machinery, or do other dangerous activities until you know how Val Toco affects you. Do not drink alcohol or take opioid medicines that make you sleepy or dizzy while taking Val Toco until you talk to your healthcare provider. When taken with alcohol or medicines that can cause sleepiness or dizziness, Val Toco may make your sleepiness or dizziness worse. Like other anti-epileptic drugs, Val Toco may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call a healthcare provider right away if you have any new or worsening suicidal thoughts or related symptoms, especially unusual changes in mood, behaviors, thoughts, or feelings. What are the most common side effects of Val Toco? The most common side effects of Val Toco include feeling sleepy or drowsy, headache, nose discomfort. These are not all of the possible side effects of Val Toco. Call your healthcare provider if you experience any side effects following administration of Val Toco. You may report side effects to Neurelis Inc. at 1-866-696-3873 or to FDA at 1-800-FDA-1088. Please see prescribing information and medication guide.